what's new in the under 65 ACA market, and how you can maximize that. Kira Uraka serves as the Vice President of Sales and Agents Success at the Health Insurance Store out of Florida, my favorite state. I actually live here. I'm actually enjoying the beautiful sunshine today, where she oversees and supports thousands of independent brokers nationwide. Her role involves connecting these brokers with essential resources to expand their marketplace and Medicare client base. She has over, get this, 6 years of health insurance industry expertise. Kira has developed compliant sales strategies and trained numerous agents to identify more effective opportunities for business growth. In 2024, she was invited to join a panel of industry leaders at the CMS Broker Summit to discuss compliant marketing strategies, highlighting her expertise in the field. Before joining the health insurance store, Kira accumulated more than 15 years of experience in sales support, management, and staff training. She earned her bachelor's degree in business management in 2021, further enhancing her professional credentials. Let's give it up for Miss Kira Uraka. You know what I like about Akira? She's got ACA in her name. You know she knows ACA.
I knew you would that. I knew that for sure.
What's that? You knew I was gonna say that?
I knew you were my boss. You guys cannot introduce me without saying that.
Gotta say, you got ACA in your name.
Thank you guys so much. Thank you for the wonderful introduction. Thank you for allowing me to be part of this presentation once again. I really appreciate the partnership with you guys, your team. And as all of you who are on this call are aware, Global Premier is one of the top Medicare agencies. You guys sell Medicare like crazy. I am on all of these integrity calls, and Tony and his team is always getting highlighted for the amount of production that you guys do in Medicare. So it's been a mission for me and Tony for the last year or so to really try and get you guys to sell on the ACA market. Like he said, this is a missed opportunity for this business unit because there's just so much potential in the ACA market. And I think if you guys really grasp the importance of it and how easy it is, it's something that if you can sell Medicare, you can sell ACA in your sleep. So today I want to kind of do a presentation for you guys. It's going to give you a little bit of a teaser. It's going to give you a lot of information that's going to help you better understand what ACA is and how you can get into selling ACA and be a pro at it. So I want to start by kind of overviewing what is marketplace insurance. So you guys are going to hear a lot of different terms when it comes to ACA. So it's all the same thing, whether it's marketplace insurance, ACA, IFP, individual family plans, ACA. There's so many names for it. Just know that it's not 100 different types of insurance. It's all the same thing. The names have just evolved as the years have passed by. But the Affordable Care Act was created the health insurance marketplace, and the purpose of it was to make health insurance more accessible and affordable for a wider range of individuals. To achieve this, the law offers financial assistance in a form of subsidies or tax credits to households with incomes between 100% and 400% of the federal poverty level. Now, in order to be eligible for ACA, there are certain check marks that a person should have. They must reside in the United States. They have to be a U.S. citizen or national. They have to be lawfully present in the United States. They cannot be incarcerated, and they can also not be covered by Medicare, Medicaid, or affordable group coverage. So if someone qualifies for Medicare, Medicaid, or if they are in a group plan that is deemed affordable, they do not qualify to go on marketplace insurance and get a subsidy. There are some little kind of intricate little things around that, but that's the overall basics. So if you have someone that fits in this category, they will be eligible. They're most likely eligible for marketplace insurance. Okay. So something really awesome about marketplace insurance is that it has what we call the essential health benefits. Every single marketplace plan has to cover these 10 things. So this means that when you enroll someone in an ACA plan, you know that they're going to have access to emergency services, ambulatory patient services, hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drugs, rehabilitation, laboratory services, preventative services, and pediatric services, including oral and vision care. So I think this is awesome because before this, there were plans out there that had very limited benefits for members, and there was a lot of rules and things in order for a member to qualify. So when the ACA came out, they said, hey, we want to give people the coverage that is essential to them. So we're going to make it mandatory. And every single person, every single carrier who wants to put on an ACA plan has to cover these essential health benefits. Now, some more things about the health insurance marketplace. So, great thing about it, you have platforms for shopping and enrolling. I'm sure a lot of you guys have heard of Health Sherpa. There's another platform called INSX. There are some other platforms that are coming out that have AI integration. So be on the lookout for that because there's going to be some great things coming as well on that. But there's one platform that allows you to quote, shop, and enroll your member. Marketplace is state and federally funded. All essential health benefits must be covered. So everything that I showed on the previous slide must be covered, which again is amazing because you know that your client is going to have the essential health benefits that they need. There is no lifetime or annual limits on coverage for the essential health benefits. Another big one, you cannot be refused for pre-existing conditions. This was big prior to the marketplace. A lot of people with pre-existing conditions could not get coverage or afford coverage. Now the marketplace offers those with pre-existing conditions affordable health coverage, which is amazing, which is great, and which is what helps the consumers. Young adults can stay on their parents' plans until they're 26. There's financial assistance through premium tax credits and cost share reduction plans, and metal levels to categorize plans by member needs. So these are all like things that I found about the marketplace. These are the things that encourage me to sell the marketplace and make me excited to sell because it just taps such a big market of people who in the past, prior to this, ACA becoming available, didn't have the access to this kind of coverage. And there was just so many uninsured people out in the world. Just a little fact right now for 2025 OEP, the marketplace ended with 24 million people enrolled. That is a lot of people who 15 years ago could not have coverage, could not afford coverage, did not have that access to coverage. That's 24 million consumers. Last year, we ended at 21 million. So there's a large increase every single year of people who are eligible for marketplace insurance. So this is definitely a market that's going to continue to grow. And this is definitely a market, again, that me and Tony want you guys to get into and start selling because it's helping more people and it will help you reach your financial goals as well. So let's break down the marketplace. So there are two different types of marketplaces. There are FFM, which is federally facilitated marketplace, and there are the state-based markets. So what is the difference? For all of the states that are highlighted in that goldish color, those states, everything is performed, everything is monitored by the Department of Health and Human Services. So in order to enroll consumers in those states, you just need to do one certification, very different from Medicare. Remember, for Medicare, you have to do your AHIP and then you have to certify with each carrier. For the marketplace, if you're selling in an FFM state, you have to do one certification. That is it. And you do your contracts, and that one certification allows you to sell in every single one of these states. And that certification, zero cost. It costs absolutely nothing to do that certification. It is a free certification, which is amazing. And then if you're selling in those states that have that gold highlighted, there's also only one platform that you have to go through, which is healthcare.gov. There are other, like I said, Health Sherpa and things like that connect to healthcare.gov. But essentially, everything is monitored through healthcare.gov. So imagine being able to assist up to 24 million consumers out there by just doing one certification saves you so much time. And every year's a recertification. Once you do the certification the first time, every year after that, it's a super short 10 question quiz, and you're ready to keep going. And then you have the other markets, which are the ones that are not highlighted, which are a little bit more difficult, but they're still doable. Those markets are handled by the state. So the state is responsible for performing all of the functions. And then those require individual certifications, and you have to go through their profiles and their enrollment platforms to enroll consumers. But it's still doable, and we still support that. So let's say if you have members in New York, you would have to complete the New York certification, and then you would have to enroll through the New York platform. But if you have members in Florida and Texas, Georgia, South Carolina, you do one certification and you enroll through one platform. So it kind of helps you analyze exactly where you want to start and expand your book of business. But just because there are different types of marketplaces, state-based exchange, excuse me, require a little bit more work, but it's doable. It's not anything out of this world, and it's not anything crazy. So it's definitely something that, you know, Tony's team, along with my team, can support brokers there. Something I always love to highlight the opportunities is on the states that have not expanded Medicaid. So as we all know, there are some states that Medicaid is regulated at the state level. So there are some states that choose to expand Medicaid, meaning that they cover a wider amount of people with certain income limits. And then there are states that choose to not expand Medicaid. So there is a smaller amount of people who qualify. So if you look at the states that are highlighted in yellow right now, or in that goldish color, those specific states do not have a Medicaid expansion, meaning that there's more amount of people who qualify for a tax subsidy. Because when it comes to the marketplace insurance, the premium tax credit, which is the credit that you're given, that the member is given to help pay for their subsidy, is determined on their income for the next tax year. So these are things that we get a little bit deeper in, that would be in another training where we're going to actually deep dive into it. But I just want to give you guys a little bit of preview. So income used is the income that the person is going to have on their taxes the next year. Depending on that amount of income is dependent on the premium tax credit that the consumer will get to help pay for their premium, which is that tax credit. In those states that are highlighted, there is a more possibility for someone to not qualify for Medicaid, so they're able to qualify for marketplace insurance. So if you're looking to start and expand business, I would start with states like Texas, Tennessee, Georgia, South Carolina, Florida, because there's just more opportunity and more people who need coverage. This shows you what the poverty guidelines are for the marketplace, and it breaks it down by the Medicaid cap states and the ones that don't have the Medicaid cap. So if you have a state that has expanded Medicaid, so the ones that are not highlighted in yellow, you have to have at least, let me get this right. The yellow ones, again, because this gets a little bit complicated, have not expanded Medicaid. So they qualify for anybody between 100 to 138% FPL qualifies for a tax subsidy. So let's look at the first column, 100% FPL. So in states like Texas, Florida, Georgia, Tennessee, the ones that were highlighted, the minimum income that a household of one needs to qualify for a tax subsidy is $15,000. But if you're in a state that has expanded Medicaid, then the minimum income is $20,000, because anybody under $20,000 is automatically going to get pushed to Medicaid. So I hope that all makes sense. If someone is in a state, I'm going to repeat it one more time, that did not expand Medicaid, their income limit to qualify for a tax subsidy is $15,000. For the states where there is Medicaid expansion, it's $20,000, because anybody under $20,000 is going to get pushed to Medicaid. Okay? I hope I didn't confuse everybody. And then it shows you here something that's called the CSR cap. Real quick, cost share reduction. These are plans for people within certain incomes where they're getting more rich benefits. So they're getting a lower deductible, lower copay, lower specialist, lower PCP. And this is obviously something that we can go more into detail at a later training during an ACA 101. But these are opportunities for people within a certain income limit to save more. And then the last column shows a 400%. This is the maximum amount of income that someone can have to qualify for a subsidy. Remember, anybody can qualify for marketplace insurance if you follow the guidelines on the first slide, but these limits are for tax subsidies. So these limits are for those subsidies that are used to help the member pay for their tax premium. So always keep that in mind. One person can make $80,000 and they can enroll in marketplace insurance. They're just going to have to pay the full premium. But if someone makes $40,000 a year and they enroll in a marketplace plan, then they're going to get some assistance in paying their premium. So now let's discuss enrollment periods and SEPs. I want you guys to keep in mind that these may change because there is a proposed rule out there that CMS has put out, and right now is a commenting period where some of these SEPs and the OEP timeframe may change, but this is what it currently stands as right now. So for open enrollment period runs from November 1st to January 15th. Anybody that's enrolled from November 1st to December 15th has a January 1st effective. And anybody enrolled from December 16th to January 15th has a February 1st effective. Right now, the marketplace is proposing to cut that and just have it November 1st to December 15th. But we are doing our best to fight that because, as all of you, the same with my agency, we also do Medicare, and having that limited amount of time makes it very difficult to juggle both. So, I can keep Tony and the team posted, and I can do an updated presentation if they like once the proposed rules come out, once the final rules come out. But just keep that in mind that next year things may look a little different, but we're definitely fighting to keep the extended open enrollment. And then anything from January 16th to October 31st are SEPs, and most SEPs are effective the month following the enrollment. So if I enroll somebody today, their plan would be effective May 1st. Most common SEPs are loss of qualifying coverage. So if someone lost employer coverage, or someone's coming off of their parents' plans or anything like that, then they can go into a marketplace plan. Loss of Medicaid. So if someone was on Medicaid and they no longer qualify, they can go on a marketplace plan. Change in household size, whether someone passed away or a baby or someone with adoption took place, anything like that. Change in residence. So if someone moves from one zip code to the other where their plan is no longer available, then they can enroll in another plan. Change in household income. This one's unique to marketplace. Why? Because all of the applications and premiums are based on the person's income. So this creates an SEP if there is a change in the household income. If someone becomes a US citizen, they qualify for marketplace insurance. And then the next one is one that's also being questioned right now. We're not sure if it's going to get extended past December 31st. But right now, anybody who's 150% or below the federal poverty level have a special election period where they can change plans every month. So if you come across a client who is in that threshold of the 100 to 150%, they actually have an SEP where they can change their plan and enroll into another marketplace plan, and you can become agent of record. This is valid until December 31st. We're not sure if they're going to extend it, but again, we'll let you guys know. I've talked a lot about how the marketplace has a lot to do with income. So I kind of wanted to, this is something that I use all of the time. This is something that my internal sales team has next to their desk. This is something that I have printed. And I think it's very important, especially when you're talking to consumers, on explaining to them what counts as income and what does not count as income when it comes to marketplace insurance. So ACA uses a measure of income called modified adjusted gross income. The total household modified adjusted gross income amount includes countable income for each person listed on the federal income tax for the year the client is getting help paying for coverage. So ACA marketplace has to do with income, and it has to do with dependents, and it has to do with pretty much anything that is going to be on your next year's tax return. If you have, let's say, you and you're claiming two of your kids, you and two of your kids have to go on the application if you want a marketplace insurance, even if your kids are not going to be on the marketplace plan. So it gives you an option when you're completing the application to say, like, this person's applying for coverage, this person's not, this person is. But everybody who's on your taxes as a dependent or anybody you file taxes with has to be on your marketplace application. So always keep that in mind. But this is just a little cheat sheet that shows what counts and what doesn't. So it's always good to know that, like, child support, workers' comp, SSI benefits, they don't count as income, but anything like unemployment compensation, tips, capital gains, and things like that, that all counts as income when you're quoting someone for a marketplace plan. We spoke earlier about how the marketplace is broken down into different metal tiers. That helps you kind of hyper focus on what type of consumer you're really working with. And this breaks down the 4 metal tiers that are available in the marketplace. So you have bronze, silver, gold, and platinum. And this slide is I think it's a great resource because it helps you pinpoint which type of coverage you're going to quote to your client. So you base it on, okay, so my client is interested in the lowest monthly premium, highest cost when you need care. So this is a good choice if you want a low cost plan to protect yourself in case of an emergency. So this is for a college student who doesn't really go to the doctor but should have coverage because he likes to skateboard, and if he breaks a leg, he doesn't have to pay full price. He'll just reach his max out of pocket. So this is a good coverage because it's not going to be high monthly. It's not going to be for someone who has a bunch of medications, who goes to the doctor. It's going to be for someone who just needs it for emergencies. You have silver, which is a moderate monthly premium and a moderate cost when you need care. A good choice if you qualify for extra savings or have more of your routine care covered. So this is for someone who goes to their annual check, who has, let's say, 2 or 3 medications, just like things that they need. It doesn't really have too much medical conditions, but uses their plan and wants the best value for their plan, would be a silver. We sell a lot of silver. Silver is probably the most that we sell. And then you have the other plans, which are gold and premium, and these are going to be more higher premium plans and lower cost when you need care. So these are going to be people who need more help when it comes to medical treatments and need more medical coverage. Then you would pitch a gold or platinum plan for them. Again, this is a great slide that helps you kind of understand exactly what to pitch to each client based off of your needs analysis that you do. Enrollment platforms. So as I stated, there are a lot of different enrollment platforms that you can use. We use Health Sherpa right now. That's used for FFM states. You can quote, enroll, complete applications, pull reports, and things like that. You can go directly through healthcare.gov or the carrier websites. Let's say United Healthcare, they'll have their own platform. Cigna will have their own platform. It makes it harder to track your book of business if everything is all over the place, but it's definitely an option. And then, like I mentioned, for the state-based markets, every market has their own platform and certifications that you would use. Like I stated earlier, there are hopefully some new things coming when it comes to platforms and some upgrades and things like that. So just make sure that you're listening and paying attention to Tony and his team and any future announcement that they have, because I know Integrity is definitely working on some things to make it easier for you guys to enroll in the ACA marketplace. Now, I'm a big believer that a lot of people see our industry as a money grab. You'll tell someone who's not in insurance, oh, how much you can possibly make on selling insurance. And the people who enter this industry thinking that it's a money grab are the ones that don't make it. The ones that make it in this industry are the ones who truly care about the consumer and care about what's right for the consumer and puts the consumer over any kind of income that they can bring in. But ultimately, we also, this is our livelihood. Most of us do this full time. This is our livelihood. So it's important that we get paid for the work that we're doing. So commissions is not everything, but it's definitely something that's extremely important because we have families to take care of and we have lives that we need to live. So I definitely wanted to show you guys what the commission possibilities are. I think when Medicare agents see what a commission for ACA is, they're automatically like, that's not enough. That's not worth my work. But if you really think about it, there's a lot of money in the ACA. An average marketplace application, first time application, takes 20 minutes to complete, and a renewal takes 7. So the only time you have to spend that much time with your consumer is the first time you submit an application. And then every year after that, you're just verifying if anything has changed, and it takes you on average 7 minutes. So I put an example here. There's a family of 5. You have mom, dad, son, daughter, and grandmother. So these 5 people are on that household income taxes. You have mom, dad, son, and daughter who are marketplace eligible, and grandma is Medicare eligible. So you complete one application and you put all 5 of these people, but there's going to be somewhere where you check saying that grandma is not applying for coverage. She's on the taxes, but she's not applying for coverage. So this is not going to impede with her Medicare coverage or anything like that. But she has to be on the application because mom and dad claim her on their taxes. So you complete an application with 5 people on it, but only 4 are eligible for coverage. And let's say you enroll them in an Ambetter plan in Florida. For 2025, Ambetter is paying $30 per member per month. So you have 4 eligible family members times 30 per month times the 12 months in the year. As long as this family continues to pay their premium every single month, you're going to get your commissions every single month off of this one-time application. That's going to take you about 25 minutes probably. You're going to make $1,440 this year. And if those people are happy with the service that you provide them with, which as Medicare agents, we know how to provide great service, you're going to renew this client the following year, and it'll take you about 7 minutes. And if they stay on the Ambetter plan and Ambetter decided to leave their commissions, because with marketplace insurance, commissions can change every year, but on average, it's $25 to $30 per member per month. There you go. 7 minutes of your time, you're going to make another $1,440. So there is a lot of income and a lot of commission possibilities when it comes to marketplace insurance. And it's not, there's a family of 5, you don't have to do 5 separate applications. You have to do one application one time. If there's a change in income or something happens in the household, then you go in and you renew the application. But generally, you're doing one application that takes you 25 minutes, and you're able to help a family. 4 people who previously did not have access to coverage now have access to marketplace coverage, and you're going to make this amount of money in the year. So it's definitely something that can help you build your business, help you build your income, and help you help more people. I'm a very big advocate when it comes to marketplace insurance. A lot of you, I'm sure, have heard on the news about possible changes coming in the marketplace. Whether there are changes or not, I truly believe that the marketplace is here to stay, and there's still going to be consumers out there who are going to be eligible and who are going to need the assistance, and who don't even realize that this is something that can benefit them, or this is something that they're eligible for. There may be people out there who are not going to the doctor, and they need to, because they don't even know that this is an option for them and their family. So it's something that we have to educate the community on. Educate those people that we know. Ask your Medicare book of business. Hey, do you have any nieces? Do you have any nephews, younger spouses, your kids, your grandkids? Do you have a grandson in college who likes to skateboard and doesn't have any kind of insurance? I should put him on a bronze plan. Even if someone gets put on a $0 plan where they pay $0 a month, you still get a commission. You still get the full commission. So, hey, if you have, tell your Medicare eligible people, you have grandkids who are out there doing wild things, let's get them a marketplace plan. Let's make sure that they're covered and that they're taken care of. So you're helping your Medicare consumers. You're keeping that connection with them because you're helping their family. You're helping more people, and you're also building your income, as I said. So I think, like Tony says, ACA is a win-win. I don't see where you can start selling ACA and it not feel great, because it is a win-win, a win for the consumer and a win for you. So with all of that talking I did, I'm sure all of you now cannot wait to start selling ACA. So how do you get started? So super quick. You make sure that you do your FFM or your state-based exchange, depending on where you want to sell. You have to have E&O coverage, so that's a 100% requirement for all carriers. You complete your contracts. You enroll with a platform, with an enrollment platform. You set it up, and then you start talking to people. You start advertising. You start putting it on your social media. You start letting all of your Medicare clients know, hey, I'm selling ACA now. If you have anybody who's under 65, please send them my way so I can see if they qualify, so I can help them. And once you start building your book of business, you start getting paid. Easy as that. So yeah, again, if you guys have any questions, but I really want to thank you guys again for taking the time out to listen to me. I hope you guys found this informative and inspirational in a sense where you guys feel like, this is something that you guys can get into. Now is the time. Before you start with your Medicare certifications, with your AHIP and all of that stuff and all those recertifications, let's get into ACA now. Let's start figuring it out now. Let's start learning, doing webinars and things like that. And let's start building your ACA book of business so that way it could be a big supplemental income on your Medicare book of business as well. But yeah, Tony, Michael, if you guys want to take over, if you guys have any questions, I'm here.
Great stuff. Michael, awesome.
Fantastic, Kiera. Yeah, excellent.
Kiera, that was beautiful. So there was a bunch of questions that were popping up. Can you knock those out for us, Michael and Kiera?
Yeah, Kiera, can you might have to scroll up a little bit, but can you see those in the chat?
Won't you read them off, Michael?
Do we have to, Michael, you want to read them off, or do you want me to read them off?
If you can see them, go ahead.
So do we have to contract with different insurance companies for ACA? Yes. So you can reach out to Tony's contracting team, and they're amazing with it. So there's different carriers. They have the list of what carriers are available in what states, but it's one certification, but you have to complete a separate contract for each carrier in the states that you want to sell. So if you want to sell in Texas and Florida, and you want to sell Oscar, you have to complete that Oscar contract and make sure that it appoints you with Florida and with Texas. You have to be appointed wherever you sell. Let's see. The commissions is paid monthly. So it's per member per month. So it's earned as the premium is paid. So the member pays their January premium, you get paid in February. The member pays their February premium, you get paid in March. Let's say the member misses 1 month of their premium, and then the next month they pay both what's past due and what's due now, then you'll get commissions twice. So it's paid to you as the member pays their premium. So I'm not sure about when there was no commissions. That was pre my time maybe, but since I've been with the marketplace for the last 6 years, there's commissions paid on ACA. There are some little regional carriers that might have like regulations, or some carriers like you have to have at least 10 members to start getting paid commissions and things like that. So the carrier is responsible for those regulations that they set, but all of these plans pay commissions. Does each carrier pay a different commission amount? Yes. So every carrier pays a different commission amount and in different states. So there are commission grids where, let's say, Ambetter will pay 30 in Florida, but they'll pay 28 in Texas. So it all depends on the state and the carrier. So they're allowed to pay different commissions. It's not regulated like the Medicare side. If you're unemployed, as long as you're going to file taxes in the next year, you qualify for marketplace insurance. So let's say you only worked for 6 months and you're currently unemployed. As long as you're going to meet at least that minimum when you file taxes, then they qualify for marketplace insurance. Is there a website to get the ACA FFM to get certified? Yes, I'll share that information with Tony and his team, and they'll share it with you guys, where it'll show you exactly where you can do the FFM, and then it'll break down also where you can do every state-based exchange as well. Does someone who does not qualify for Medicare get ACA? There are certain regulations when it comes to that. I can do additional research and send it to you guys. I have to find the information, but there are certain circumstances. If someone doesn't qualify in certain circumstances for Part A, they qualify for marketplace insurance. There's like a strict guideline there, but yeah, there are certain possibilities where someone is Medicare age, doesn't qualify for Medicare, so they can go on marketplace insurance. Do you have to resubmit an application for clients each year to keep them on your books? So as of right now, you don't. There's something called passive renewals, but you always want to, shop for your client, just because marketplace plans change so much year to year that you want to make sure that your client remains on the best plan for them. But technically, as long as they're not on a $0 plan, there's a passive renewal where if nothing's changed, the premium hasn't really changed, you've checked that out, and they're happy with their plan, they can just automatically renew into the next year, and you'll continue to get that commission. What tools do you need to verify the client? So there are tools embedded within the enrollment platforms where you would quote for the client. So it would pretty much, you would add their age, their zip code, and their income, and then it would pre-qualify them and it would show you a quote on what their estimated tax subsidy would be, and you would be able to shop for the plans there. But just as long as a person has an income, is going to file taxes, and they're lawfully present, not incarcerated, then you're good to go. There's not too much more besides that when it comes to qualifying someone for marketplace insurance. Are there regulations for compliance? So there are certain regulations, not as intense as the Medicare ones. There are regulations such as you have to have consumer consent. So whenever you're going to complete an application, there's a form that or a certain type of consent that you have to have from the consumer, which again, I can send you guys more information on that as well. It's kind of like a scope of appointment, but a little bit less regulated. So a lot of people compare it to a scope of appointment, but that's required. And then if you are taking over a client that already has a marketplace plan, when you're completing that application, you have to call the marketplace with that person on three-way so they can authorize you to be agent of record. So this is something that happened new last year because there was a lot of issues in the marketplace of people stealing clients because it was so easy to get into people's profiles and change NPNs. So CMS came out with this new regulation where if a consumer is already enrolled in a marketplace plan, and you're going to take over as agent of record, the consumer has to call with you on the line and authorize you to change. But when it comes to compliance, that's pretty much it. Obviously, do right by the consumer. Make sure applications are thoroughly completed and that the person you're enrolling in a plan qualifies for a plan. They're lawfully present. They have income and things like that. But when it comes to compliance, like marketing it, there's not a lot of rules. You can door knock when it comes to marketing for ACA. How do commissions work for an agency with a downline? That's completely up to you. You can set it up where you get paid your agent's commissions and then then you pay them out, or they get paid their commissions directly. So marketplace allows for both to happen. Keep in mind that there are some carriers that pay the upline, meaning Global Premier, and then they pay you guys out. And then there are some carriers that pay the downline directly. So there are some where there's not much of an option, but definitely it depends on you. You want the commissions and you pay out your downline, then you can do it that way, or you want them to have their commissions direct, you can do it that way as well. If you're riding through Health Sherpa, can you enroll with all those carriers and get paid? Yeah, you have to be appointed with the carrier. So let's say, example, in Florida, you can appoint with you can sell with every carrier but Florida Blue. Florida Blue is captive. So you can sell through any of these platforms. You just have to be contracted and appointed with the carriers in order to get commission. Can they be done electronically and no recording, correct? If we're talking about the applications, yes. The applications are all done electronically and you do not have to record anything as long as you have that signed consent from the member. I've had clients complain about fake plans on the marketplace. Do you know anything about that? No, I've never heard of that. As long as you're enrolling them through healthcare.gov or a trusted source like Health Sherpa, then this should not be run into. There are a lot of lead companies out there who advertise plans incorrectly. But when it comes to fake plans, I haven't heard of that. With the lower premium plans, do you still have to meet the high deductibles before your clients receive coverage? It depends. It depends on the plan. Some carriers, the coverage starts before the deductible, some after. So there's a lot of different options. So it's just shopping the plan. There are definitely lower premium plans out there that the member can start getting care before reaching a deductible. I've seen them where it may be a little bit higher. Their copay for a PCP might be $30, $40 as opposed to $5 or $0. But there's definitely plans out there where they can start getting coverage before having to meet that deductible. Are there overrides to an agency or ACA sales done by their downline? That's a Tony question. So you can get with Tony on that. Will there be override? Again, that's a Tony. Are leads available from lead vendors for ACA prospects? So they're actually, I don't know how much you guys use Lead Center, but there's leads for ACA on Lead Center. So on Integrity's Lead Center, there are ACA leads. So you can purchase leads on there if you're looking for a lead platform. Can you enroll smaller groups with 20 or less employees? So there's another form of ACA. It's called ICRA. It's something that is kind of, you guys are going to hear more and more about it, ICRA. I'm still learning about it. I am still trying to fully understand it. And it is for employers, usually smaller employers, where it allows their members to choose marketplace plans, and they provide they fund those plans like a certain amount of money for their employees. But I don't want to get too much into that because that's a completely different topic. But definitely there's opportunities for smaller groups with 20 or less employees to enroll, but it is through a different program connected to the marketplace, which again, Tony, in the future, we can do another presentation on that. Okay. No, it's not shop plans. Shop plans, I have never gotten into shop plans. Those are very complicated. It's called ICHRA, ICHRA. It's an acronym for Individual Reimbursement Health. I forgot what it was. I'm sorry, but it's ICHRA. I'll put it in the chat. I think that's it. I don't see any other questions.
I do have a question.
Fantastic. Oh, go ahead.
Yep.
So I was running across this in the past when I was doing the ACA. When you have a person that has a husband and spouse, but age different, and a husband or a spouse or wife, they become Medicare age. Now they're eligible for Medicare, but they cannot really go onto the Medicare platform because they worry about the spouse, and let's say there's a 5 or 6 year difference. So what was going on when you tried to apply for the ACA, you had to include the second person on the application if they're filing taxes together for the total income, and then that would, even though they was not eligible for, the person on Medicare was not eligible. So that became a problem. How can that be addressed when you have two individuals that's still working, but the individual would like to go on Medicare, leave their group plan, but you still have a second person also working with income. So they take both those incomes into consideration, even though only one person is going to be eligible.
Yeah,
how would you work that?
Yeah, so that's exactly how it works. So they would apply for marketplace insurance, and then the spouse who's on Medicare would put that they're not applying for coverage, but they would have to, if they're filing together, if they're filing jointly, then they have to put both of them on the application using both of the income, which helps them because it gives them a higher subsidy at the end of the day. So it kind of helps, but there's no problem. The other person can still enroll in Medicare because the application is stating, hey, these two people are going to be on the taxes, they're filing together, but only this person is applying for marketplace coverage because this other person has other coverage, whether it's employer, whether it's Medicare or anything like that.
So, but aren't they taking both of those individuals' income into consideration, of which might put that one person that, let's say, $80,000, would that one person still get that subsidy because of the high income?
So it would go, you would go to the chart, and it would show that there's two people in the household, so the incomes go.
Okay.
But yeah, they would still take both incomes into consideration because it's based off of their calculations are based off of what the household can pay or what the household cannot pay.
So they would file separately.
That file separately the following year. Make sense?
Yes.
Any other questions?
Feel free to unmute yourselves, team. By the way, if you do have questions, you don't necessarily have to chat it in.
And then one more question. If they're paying for health insurance, are they able to write that off on their taxes if they're paying for that health insurance? If they're not on Medicare?
No, because it's a service. So they'll reconcile the tax subsidy at the end of the year, so they'll get a form. So it's not really a write-off per se. I mean, I would talk to a tax professional to get more details on that, but no, they get a 1095-A form at the end of the year, and then that's when the premiums are reconciled. So that's why it's based off of what you're putting in, what the member's putting in their taxes. So if that makes sense.
Okay.
Kiera, I'll wrap this up for you. Is there I'll just call it a sales training on this, like a mock presentation kind of thing? What questions to ask? Is there a fact-finding sheet? That kind of thing?
There's definitely another presentation that I have, so I can put that together and send it over to you guys. That it's more of an ACA 101 that's going to give way more details and things like that.
Got it. Is that like what you presented to us last year?
An updated version of that.
Updated version. Okay. Yeah. Awesome. Would love to see that. Thank you. Team, any other last-minute questions or comments?
Just the one on the tax thing for Everett. Yeah, I mean, if you're 1099, I think you get to write off all your health, everything that you pay, your vision, dental, hearing. I mean, you got all those write-offs that you're able to do as a 1099, but I didn't hear if that was the actual question.
No, they're working. They're not 1099. They're working for a company. The second person is still working because the other person is on Medicare, but they're still working.
Got it.
They've been able to get into business, right, Jason?
Yes, sir.
Great questions, guys. Great stuff. Kiera, awesome. Appreciate you.
Thank you guys for having me. I hope this helps.
This was awesome. Awesome.